Well, good morning and welcome to VanPodcast number 4, where today we'll interview Michael Elliott, President and Executive Director of the Valley Medical Foundation, and his role supporting public hospitals all through Santa Clara Valley. You can find this podcast, VanPodcast, on Spotify, Google, YouTube, Anchor, or wherever you get your podcast. So welcome, Michael.
Thank you, Michael. It's a pleasure.
I feel like you're talking back with the same name.
Well, I always feel better with another Michael. I feel like there's a kinship that we have.
Indeed. It's a great name, and you're a great person. I appreciate you being here today.
Well, likewise. Now, I just saw your beautiful new building. It's incredible. It's going to make a big difference to Willow Glen, so thank you for having me here today.
Well, you're welcome, and you're right. We're the Death Star is fully operational, and we're here at the intersection of Lincoln and Willow, and we're very proud to be here. So you actually are my first guest in the new building. So what have you been up to? What's been going on?
It's been an incredible last 2+ years for me, being part of this community's, I think, heroic and admirable COVID response. I'm very proud that this county was so proactive and progressive in confronting the virus and protecting the most vulnerable and getting this community vaccinated and getting our economy opened up again. And for me, transitioning into this role unexpectedly on an acting basis last March when my predecessor suffered a stroke that fortunately he has recovered well from, and then assuming the role full-time in January. A huge honor to lead the Valley Medical Center Foundation and to lead all of the fundraising activity and the advocacy activities for our best in the country public healthcare system.
Sure. Well, I think, you're not new to Santa Clara Valley, which, we're going to talk about a little bit because
I'm old now.
Yeah, well, you're not that old. But you like you said, you're filling some incredible shoes in an incredible organization that I've had the privilege actually to, get more affiliated with. And but I kind of wanted to talk a little bit, for our audience to know who Michael Elliott is. I mean, so let's talk a little bit about that. You've got an interesting story. You've lived here for pretty much your entire life, but you weren't born here.
No, I was born in Madrid, in Spain, just after Franco, their dictator, longtime dictator, had died.
General Franco,
the Generalissimo. Who is dead, if we want to recall that old Saturday Night Live joke. And my father, who was a civil engineer, a mechanical engineer, was there as a consultant for GE as the Spanish economy was rapidly developing and they were building civilian.
What time period would this be?
This is 75, 76.
We just gave away your age.
Yeah, we sure did, didn't we? No, I'm a bicentennial baby, proud of it. So I was born, I don't remember it, but it is sort of part of who I am. So I'm a foreign-born American, moved back to Santa Cruz in 77, which is where I grew up.
You did. You hit the beach a lot there? What was Santa Cruz like growing up?
Yeah, it's a great place to grow up. And it's funny, I always get the number one question I get, did you surf? And I say no. Yeah, you said beach, but people always ask me, did you surf? And I said no. I mean, everyone tries it, and I think most normal people say, this is really cold, and you have to get up at insane times to time this right. Like, surfers are like legit crazy people. I love them. Sure. But like to do that sport, your commitment to it has to be insane. No, I did lots of music and outdoor stuff, and growing up in Santa Cruz is great. It's a great place to be a young person.
It really is, and you also have a great affiliation with a local high school here. Though you grew up there, you went to elementary school, and then you made it over the hill to do what here in your high school?
Yeah, my mom wanted to make something of me, so she's like, I'd like you to look at this all-boys Catholic school over in San Jose. And I was like, well, what are you talking about? Like, I've never heard of this place. San Jose is like a big, weird city that we only go to for the airport or for like Costco. Like, I don't want to go over there. But no, I went to Bellarmine, and actually it had a huge influence on me, and it's a big reason why I'm still here. Catholic social justice teaching influences my work every day and how I think about the world and how I think about my part in the world. And in a way, it tied me to the Valley and tied me to this remarkable city in a way that I wouldn't have predicted, and certainly my mom wouldn't have predicted. So I'm grateful for that opportunity to have gone to that school.
It always amazes me how there's always a tie back to one's most formative years, and a lot of times that is high school, and college obviously plays a role in that too. But for whatever reason in this area, the Bellarmins, the Presentations, the Middies, the St. Francis's, and then of course into the peninsula. These great Jesuit high schools play an important role, and they teach a lot of foundational items to young men and women, and it's great to see that. I mean, and obviously you practice what you preach, and I guess that also happened as you advanced into college as well?
It did, but first I have to say as a Belgrad, I can't allow for good things to be said about St. Francis on this. Please edit that out.
My apologies to Steve Schott Jr. and anybody else that went to St. Francis.
No, it did. I went back east to the University of Massachusetts. My mom's side of the family is from Boston, and that state and that part of the world is I feel very connected to. And I was the kind of student. I was a decent student, but not a brilliant student. But mostly enjoyed school for all the other things that school offered outside of academics in terms of being involved. I was editor of the newspaper and active in a couple different activist groups around financial aid and other issues that impacted low-income kids. Had a lot of fun, played music, did lots of dumb college stuff that we won't talk about.
Why is it everyone that's in the Valley Medical Foundation has some connection to music?
It's one of the unwritten things when we hire, like, what instrument do you play? Now, I don't want to compare myself. I'm like a music hobbyist. You wouldn't want to pay to listen to me play drums, but I can hold my own.
There you go. There you go. And so would you say that during this time, I mean, you're in college, and obviously did that kind of push you into some of the things that you're doing today, or was that post-college where you started your activism career? Because you have a deep bench into activism, which we'll talk about. But what was the life event that you think pushed you between high school and college to promote the things that you do today here in the Valley?
It's a great question. I mean, I definitely had, I sort of thought about social change I wanted to live a life of meaning and making a difference for others, and thought of social change in this sort of grandiose cinematic way that you're leading great rallies and that you're working for some giant global or national effort. And for me, it was actually a semester abroad I spent in South Africa, and this is just after the end of the apartheid regime in the mid-90s. And seeing people that had been at the forefront of that movement who were now grappling with, okay, we now have real democracy in this country. How do we deliver healthcare in rural settings? How do we build affordable housing? How do we develop clean energy? How do we structure local government? These things that were they aren't that sexy. They're kind of mundane, to me at least at that time. But sort of a light bulb went off, and I said, this is what changes. It's working in local communities, and it's working on issues that affect people on a daily basis, that impacts their quality of life and their ability to enjoy the benefits of democracy. So that sort of cued me like, maybe I won't try to go to law school or go to the Foreign Service or work at the UN, which is sort of vague ideas that I had at the time. Maybe I should think locally and work in grassroots ways to make change.
Yeah, and you've definitely done that. And I guess it started first with it came back to your Jesuit roots a little bit. So you exit college, and then another big life event happened for you at City Year.
Yeah, that was what appealed to me at the end of 4 years. I said, okay, put me to work, and I want to do some dirty work, and I don't want it to be too theoretical. I want it to be practical and applied. So I said, I'm going to do a year national service. I really believe in that. I still do. I like this idea that, as a way to build a common sense of American identity around supporting each other and building community and serving our country in not necessarily a military context, although I honor that service as well, but giving other ways to serve the country. So I like this idea of, I'm going to do a year national service. I'm going to come back to San Jose, a city that I didn't really ever think I'd come back to, and work in schools and work in community centers and develop after-school programs for kids and spring break programs and other opportunities for kids in low-income schools. And it was a life-changing experience. And from that, I met every single person that I've worked with since, and I met my wife. So it was a big 10 months for me. That turned into 3 years, actually. I stayed at City Year for 3 years, and that was my first job in fundraising. That's where I first worked with my predecessor, Chris Wilder, and a lot of the other folks I've gotten to work with today.
It's interesting you mentioned that. I think maybe some of the unintended consequences of COVID for the generation that graduated a high school or college was, a rethinking of, the gap year or, their service and what they can do for society. Do you see a lot of young people kind of taking that approach now as you work in the nonprofits and the healthcare systems? Are you seeing more young people look at this as saying, hey, yeah, I got a business degree, but you know what? I could do better by doing this for my community. Are you seeing that with this generation?
I mean, I see, I'm very fortunate. I work with a lot of mission-driven, idealistic people that went into healthcare, that went into medicine, that went into government and want to make a difference. And yeah, I think that there is, you've worked in the Valley a long time, and it can be a grind, an exhilarating grind, but a grind. And I think all of us sometimes want to take a step back and think about how we add meaning to our lives and how we add meaning to other people's lives, because that enriches us. So, yeah, I think in COVID we had to ask those hard questions, like who are we working for and why are we doing this? And like maybe life is shorter and less predictable than we thought, and we ought to try to be doing things that are positive and that we love to do. So yeah, I think you're onto something there. I think people are thinking about that more and more, and it's a privilege. I mean, for some folks, let's acknowledge, like, they got to support their family right away. They got to do whatever they can to earn $1. So I don't take that for granted that I had an opportunity to make almost no money for a year, living I think on $125 a week stipend. This is in the late '90s, but rent was still high in Silicon Valley in the late '90s. I live with my dad, so I was privileged to be able to do that. And all he asked me to do is pay for a phone bill and a little extra PG&E. He didn't charge me rent, so it was a privilege to do it, and I think we should make it more accessible so that more people can do those kind of experiences and opportunities, because it's going to make them better people.
I agree. I mean, I think that's what separates Silicon Valley, specifically Santa Clara County, is that we do have a lot of, like you said, driven people who want to make the world a better place. And I think, it sounds like your experience there at City Year in the beginning was extraordinary, and then you went to a working partnerships, and kind of tell a lot of people know that name, and it's still very active to this day. But talk about that, because that kind of turn really I think has shaped your life to the current part of where you're at in your career. So talk a little bit about your next adventure, because I think that really probably prepared you for this leadership role that you're in now.
Yeah. Well, Working Partnerships is we used to call it an action tank as opposed to a think tank, a public policy research and advocacy organization. It comes out of the labor movement, but very connected to local faith communities and community organizations and neighborhood organizations. And they had in the early 2000s really were the driving force behind the Children's Health Initiative, which was the first county-based universal health insurance program for kids in the United States.
And what year was that? That was...
That went into effect in 2000 and was extraordinarily successful. These were the convincing the county and later the city of San Jose and some private funders to take some of those tobacco settlement dollars from that big giant tobacco lawsuit, if we remember, when we proved, guess what, tobacco's addictive and the industry should pay back local government for the costs that it's incurred dealing with that addiction. Taking those dollars and putting it into this new program, which at the time, there were several different federal and state programs that provided health insurance to kids, but there was wasn't good coordination between the two, and there was a huge gap, and for folks that earned a little bit more than they were allowed, they didn't qualify. So we kind of created an umbrella program, a one-stop shop in Santa Clara County where parents could go in, and regardless of which program they qualified for, we get your kids signed up. So when I saw that happen, I was at City Year, and I was working in a lot of low-income schools with kids that didn't have health insurance, would talk about how they didn't have regular access to medical care. And I said, I want to go work there because they're doing social change beyond just 30 groups of kids at a time. They're doing it 100,000 kids at a time, because that's how many kids got enrolled in this program in the first year. It became a national model. So I went there for 6 years, and as a community organizer to work on affordable housing, healthcare access, but mostly what I did, because I wasn't as smart as the incredibly smart policy folks that were there, but I was good at political campaigns. So I got pulled a lot to work on local and statewide political campaigns, where I learned a lot and lost as many as I won, which is how that business works sometimes. Yeah. You can't win them all, but that was, I think local politics is the intensity, the intimacy of it, and you know how this is because you're very active, locally. You just get to see some really great people and get to work with some really, really smart people in a really close way. So I love that work. It was ruinous to my social life because you work 3 months in a row without a day off. but very rewarding, and I'm glad I did it.
Yeah, our careers are not that much different in that regard, where I started out also working, school campaigns and supervisorial campaigns. We were on the same side a lot of the times, and we've been on different sides during that time. And
We're still speaking today.
well, you can never take those things personal because they roll every 4 years, and they're important, though. And I do appreciate the role that all the stakeholders play in local politics because, we need to diversify our candidate base, and we have to have voices from all sides. And that's what I love about Silicon Valley, too. And despite the fact that, we might have altering opinions, I think there's always common ground. And that's why I love local politics and the effect that it has because, it's not partisan. It's just about making your community better. So, you worked on those campaigns with some of the greats, the Amy Deans and the Phaedra Lampkins and the Cindy Chavezes, who I know we're all affiliated today. And I guess even the great Bob Brownstein was there. And my association with him dates back to the Susan Hammer, and he must have been a kick to work with.
He was. If you ever needed a World War II analogy to sort of motivate you, he was that or Norse mythology. He was very good at putting everything into the context of the Battle of Midway. So I love Bob, and we did. No, Bob was a genius. I think we sort of underappreciate his accomplishments in this community by just his sheer smarts and force of will and commitment to doing good work. Yeah, he was great to work with. I'll also give a shout out to Philip Butt, my good friend, who was the political director, who's now at the Washington Post. So he and I working together. He's at the Post? He's at the Post, yeah. He's a national correspondent. He's got a book coming out. I'll plug that.
Are you going to be in it?
I'm not in the book. Yeah, I've read it. It's really good. I'll plug it when it comes out. But no, I worked with incredible people there. And that to me, in your working life, that's such a gift. You never want to be the smartest one in the room. You always want to be working with people that are smarter and better than you because you learn much and they push you and they challenge you.
Oh, yes.
That was my experience for sure.
The smart moniker cuts both ways.
Sure
I actually loathe that expression when someone tells me somebody's smart. I immediately get my radar up and say, well, we'll see. But to your point, though, it's always good to surround yourself with smart people and take advice. Sounds like you've done that your entire career.
I've tried.
So you decide that you have enough of campaigns and that you probably...
Well, I took a big L and was sort of done.
Yeah, I know which one that was. And we're going to redo that one here shortly. But my audience knows me. They know what that means. But it's now you've decided that you wanted to go to work at a job that you'd end up with in a weird kind of way, but the Valley Medical Foundation comes calling, and so talk to me about your entry to that, but more importantly, talk to me about the Valley Medical Foundation, in a synopsis way because it's very far-reaching. Because you're doing some incredible things there, and so tell my audience what the Valley Medical Foundation is, and indirectly how you got there.
Yeah, well, in Santa Clara County, we have this multi-generational commitment to providing health care to everyone, high-quality health care to everyone, regardless of ability to pay. And I think for people that have lived here all their lives, it's easy to take for granted. But every county, we're unique in this county in that we've thought about our public system not just for people that have no other option, although obviously it is oriented and deeply committed to vulnerable populations and caring for people that truly don't have other places to go for their health care. But it's really a system that's oriented around what are the health care needs of this community broadly. So the analogy I always say is UC Berkeley is the best public university in the world. And it doesn't just exist for the kids that didn't get into Stanford. But Cal grads hate when I use this analogy because they think I'm insulting them. But I'm not. The point I'm making is that we built a university system for the good of the whole state, thinking holistically. And that's what we've done in Santa Clara County. We built a public system that is really thinking about what are the health care needs in this community for everyone. Because what I always remind folks is sooner or later, no matter where you normally get your health care, you're going to rely on Valley Medical Center, O'Connor Hospital, St. Louis Regional Hospital for something. You or someone you love, for emergency or trauma services, for our world-class burn center, which we're going to talk about, for pre- or postnatal services, for specialty care. Because in many cases, that system is the best around at providing those services or the only one. And we can't have a functioning community if people can't get access to essential healthcare services. So that's our public system, and it's taken years of investment and support by the voters and electing members of the Board of Supervisors that believe in healthcare for all. This goes way back to Susie Wilson when she was on the Board of Supervisors, and Zoe Lofgren and Mike Honda, and all the way through to the great leaders today, Susan Ellenberg and Cindy Chavez. And it is something we should be very proud of here. The foundation was formed as an independent nonprofit in 1988, sort of a unicorn, to support a public hospital. And people said, well, who's going to give? Why would I write a check to a government hospital? Aren't they funded by the county? Well, it turns out when your mission is to care for everyone, regardless of ability to pay, there are so many needs. So the story of our great public health care system in this valley isn't just we've had good members of the Board of Supervisors and the county has made investment. It's been community support in the form of donations and other ways of philanthropy that have built that system, that have allowed us to innovate new forms of care, to expand access, to directly support patients, and I think more than ever after this last 2 years, support healthcare workers. Yeah. Because our healthcare workforce we cannot take them for granted. The trauma and the physical and emotional and spiritual exhaustion that was endured by that workforce in this last 2 years, it's hard to put into words, and we need to be there for them, and we are. So the role of the foundation is to make sure, the VMC Foundation as an independent nonprofit that's founded to support our public healthcare system, is to make sure that healthcare system is here forever, right. That the doors are open to everyone always, and to help that system be better through innovation, through piloting new forms of care, and to make sure that anytime there is a need where there aren't public dollars, and that's every single day, that we can be there for them.
Yeah, and thank you for explaining that, because even myself, I've lived here my entire life, and I'm not sure our listeners and a lot of people understand that connection, and the importance of that was never more on display than during COVID, and you touched on that with our healthcare workers. But I guess, obviously, public hospitals are dealing with all the items that you mentioned on a day in and day out basis for healthcare needs, but the impact of a COVID. But I also think of an impact on other natural disasters that could occur, which we all know can happen in California, in addition to wildfires and other items that you just can't plan for. It seems the foundation is really there in that regard, and you played an essential role during COVID. And to me, that is one of the shining moments, not just of the Valley Medical Foundation in this community, but of your leadership. And I think you should be commended to that. And I know that's been one of your great successes. And maybe you could talk a little bit about the Valley Medical Foundation and its support and its leadership it played during COVID.
Well, I appreciate you saying that. I mean, it was the honor of a lifetime for us to be able to play a part in this much broader effort. In the earliest days of that pandemic, there was a lot of fear and a lot of uncertainty. Initially, if you remember, it was around PPE, protective gear, and we were seeing the stories, and we were seeing healthcare workers, and thousands died globally, going into ICU environments, being exposed, not having the protection that they needed, and that was, I think, we got closer to total sort of healthcare system collapse because people just not coming. Say, I'm not going to do it. I'm not going to come to work. I'm not going to put my life in danger in that way. We launched a massive campaign here locally and asked the community for donations of whatever they had, with no idea what kind of response we would get. And it turns out that there's a lot of PPE that was out there that people realized they had in storage. Big companies that had bought masks for their workforce for wildfires, dental offices that were closed, schools, university, research centers, folks that just had hand sanitizer and a box of masks in their home. And we launched this effort, and within the first week, we had something like 500,000 items donated. And within 6 months, we had 5 million items donated. Wow. And it came from all walks of life. And we started seeing church groups raising funds to import some of these materials from Asia. We saw, San Jose State went through all their labs and brought it all to us. Dental offices bringing all the things to us. IBM, Facebook, Apple, Intuitive Surgical, all these companies in the Valley stepping up and in some cases, most remarkably, figuring out how to manufacture things on their own. I mentioned Intuitive Surgical. Google was another. Made face shields. They figured out how to fabricate face shields using their own assembly lines for other products, which was remarkable. And so for me, COVID brought out a lot of ugliness around the country. We've seen the people shouting on airplanes, and we've seen the people protesting mask mandates and things of that nature. I feel like in this valley, I saw the best of people. I said, what can we do? How can we help? How can we step up? And we saw that in big ways with big Fortune 500 companies finding ways to help. And we saw it with high school students with 3D printers in their garage figuring out how they could help. And it was one of the most inspiring things I'll ever see. And I'm proud to say that in this county, we didn't send nurses and doctors into ICUs wearing trash bags as PPE or asking them to go in without a mask that they needed. We were able to stem the tide and get through that first really critical period where those PPE shortages were a real looming problem. So enormously proud of that. And beyond that, we had over $20 million donated, which went into right away. What did we do within the first month? We bought 700 iPads so that Valley Medical Center could deploy a telehealth program for the first time in its history. We bought refrigeration units before the Pfizer and Moderna vaccines were approved, anticipating it would be hard to get those once they were, because everyone was going to suddenly need these insane specialty refrigerators that got the vaccine down to minus 90 degrees. So we were able to anticipate and to be able to act very quickly thanks to donor dollars supporting this massive response by our public system that completely led the way on vaccination, on testing, and making sure the people that were COVID positive had adequate care. So best thing I'll ever probably do in my life, and proud to do it, and 100% did it because I could see the fear in my eyes of our friends and colleagues who actually go into patient-facing environments every day and expose themselves to danger. I could see the fear in their eyes in those early weeks, and we just said, if there's anything we can do to help, we're going to do it. And I'm just so grateful that the community responded in the way they did.
Well, you should be commended, you and all the members of, not just VMC, but, the foundation and everybody, that it was an amazing effort. Again, I think most people behind the scenes don't realize that, because we were all kind of trying to figure out, our own individual kind of, needs, which we're shifting. And I know that the foundation does more than just raise money. There's also the mental health awareness and all the things that you provided. And it just goes to when people start, thinking about Santa Clara County and, it's so expensive and it's this and it's that. I challenge anybody to move to another part of the country and have this type of support that's actually caring for them, that this is an organization that's caring for them at every level, from the most basic need of a hospital stay to, just your mental health and to protecting people. So I commend you to that.
Well, thank you. And I agree. We should not take for granted where we live. And I think people recognize that, when they went to Levi's Stadium or they went to the fairgrounds and they saw, wow, where did this come from?
That's right.
That was our public system stepping up. And I'll tell you, it wasn't like we had a couple thousand idle people just waiting around to stand up these mass vaccination sites. That was people giving up their nights, giving up their weekends for months at a time to serve their community. And that's what happens when you have a public system and people that are really committed to the health of their community in a really deep, meaningful way. So it's a special thing we've got here.
It really is. And, speaking of that, I've become, thanks to PRX and Brenna Bolger and her long affiliation with the Valley Medical Foundation, and through the urging of many people, including Terry Downing, who does a great job for Michael Van Avery and Republic, and all the things that we try to do philanthropically. Actually, we'll be showing you some more of this here soon, but Republic was just named one of the top 50 philanthropic organizations in the Bay Area. And I like to promote that and tell people it's probably one of my most proud achievements. But, there's also another part that you support there at the Valley Medical Center. That's the burn unit. And that's near and dear to my heart. So not too many people, a lot of people know my story because I'm pretty open about it, that I was, burned with over 60% of my body in 1972 when I was 2.5 years old in Willow Glen. So I haven't strayed very far since then. But in Willow Glen at my grandmother Van Avery's house, I was in a childhood accident involving gasoline and a water heater. And ultimately that led to the accident. And I was rushed by a police officer, San Jose police officer, rushed me to Valley Medical Center at the time because it has literally the best trauma unit probably in California, and frankly saved my life. And then over the course of many surgeries and many doctor trips over, say, really a lifetime, but it's been an essential role in my life. But I know the Valley Medical Foundation plays a big role in the burn unit, and I kind of wanted to talk a little bit about that and the great, amazing work that, COVID was great, but Valley Medical Center and the burn unit has been doing this literally for 50 years?
It opened in 1970. You were one of the earliest patients, and I want to thank you, Michael, for sharing your story, because I think a lot of people that experience catastrophic burn injuries, kind of suffer in the shadows. And I think you've been an example and an inspiration for someone that, and now our burgeoning partnership in bringing attention to people that are victims of major burn injuries, and that there is recovery and there is a beautiful, wonderful life to live and to recover from. So the Burn Center is, I think, one of the crown jewels of our public system. There's a lot of parts of hospitals are complex places. It's made up of lots of different service lines and clinics and departments. The Burn Center's been there since 1970. It is one of 3 burn trauma centers between LA County and the Oregon border. So these are very precious, rare entities, and the reason for that is they're very expensive to operate. It takes really specialized nursing and medical care, high ratios. So I think if you're a hospital system that's focusing on profit, you don't want to be in the burn business. But if you're a hospital that is focusing on what are the needs of people that live here, you got to do it. And it's been a long-standing area of strength for Valley Medical Center. And it's what's unique about the Burn Center at VMC is so it's an 8-bed ICU, and so it provides that first very high level of care, but it integrates rehabilitation. It integrates the behavioral health side of it. It integrates the therapy and the getting back out in society piece of it, particularly for kids and younger burn patients who suffer so much stigma when they go to school, supporting burn camps for them during the summertime and other peer support. So very complex, high-level, ICU-level care, the whole continuum all the way through outpatient services and services when people go home. And to me, some of just the most compassionate, hardest working people in healthcare, because as you know, burn injuries present really intensely to a healthcare professional. And burn injuries happen for lots of reasons. It can be thermal, contact, electrical, chemical. They're horrifying injuries, and people come in really difficult conditions and really suffer. I mean, it's all of us have been burned a little bit. I actually have a pretty significant burn injury on my hand that required 2 surgeries, but we've all burned ourselves with hot water, boiling water, and it blisters and it hurts for 2 days. Well, imagine that covering the majority of your body and having bandages changed every 3 times a day to avoid infection, and sort of the pain and the agony involved in that. That takes a lot to do, and that takes a lot out of the team there, but they do it so well. So, yeah, the Burn Center, again, this is one of those things. You may have never heard about it, but you will be so grateful for it, as I'm sure your family was when they were probably scared out of their mind on what was going to happen to you. And unfortunately, you lived in a community that had access to this care. And now we're sitting today in this incredible office building that you've built after a career of tremendous success, and you've been able to live a full life. And that's what we want for everyone. Right. That really is the issue for burn patients. It's sometimes the physical recovery, I think, it happens, and we've got great advancement in that. I think a lot about veterans that have been in the Iraq or Afghanistan wars that, to your point, they suffer these horrific injuries and they come back not recognizing themselves. And so it's more of the long-term part of it that I think is so important that Valley Medical does an amazing job with, whether with the Phoenix Society or just, having the ability to have mental health professionals, bridge, some of these folks and young people, middle-aged people, older people who, I think it's more of the post-stress that happens. And for me, it wasn't that difficult because I grew up with it. But my heart goes out to a veteran or someone involved in a car accident later in life, and that alters them. And again, I just feel like the burn unit here is something that is not probably promoted enough, and that's really going to be our work together and PRX and the community that we've built here
in the Republic family, we're going to make a large push to, make burn awareness part of the spectrum, because I feel like there's a lot of great exposure to many different aspects of life that are different and that allow people to have compassion and care. But for some reason, the burn spectrum doesn't necessarily get the same platform, in my opinion. And I hope that we can change that, because we need these donations for the burn center, and we need to continue. Because to your point, unfortunately, healthcare accidents or home accidents will never go away.
Yeah. Though we can do more, and this is part of the work you're going to be supporting in looking at those areas. Finding prevention's a big piece.
Yes.
And the burn center does a lot on that. And there's a lot of education we can do. And it's one thing when it comes from a general public service message. When it comes from people, doctors and nurses on the front line, it makes an impact. So yeah, you're right. We'll always have burn injury patients, but let's work together to reduce them, and we can.
And we will. Yeah. And we will. And I want to thank you for all your hard work with that. Well,
thank you.
So Michael, we're heading down to the last path here. I like to keep these podcasts tight and allow people to review them quickly.
It's been an excellent interview. I think you should quit your day job. This should be it.
I'd like to, but it just doesn't pay enough yet. So, but we get to the last part of this, which is kind of fun. It's kind of the rapid fire questions, and I have to thank Maggie Rich and PRX for some of these outstanding ideas here. So I'm just gonna give you a phrase or a person, and you just give me back a little tease. Keep it within maybe 10 words or less. What the reaction.
I'll do my best.
Yeah, you're good though. You're concise. Okay. So let's start first with a good one.
Okay.
Yo MTV Raps and Chris Wilder.
So that was this. I don't know why. That was the subject line I sent to Chris when he posted the job that he later hired me for in the email I sent to him. I don't know why I said that. I used to like that show. That was a great show. I was an MTV. Awesome. Yeah, I was an MTV kid. So that was the subject line for the email I sent to Chris. And hey, you posted a job, I'm interested. And he said, come meet me at Gordon Biersch back when Gordon Biersch existed. Oh, and he hired me that night. And that became a running joke between he and I.
Yeah.
That important emails would have the subject line, Yo MTV Raps.
And how's Chris doing? He's
fantastic. I'm going to see him today. He's for someone who is lucky to be alive, his recovery's been phenomenal. He's getting closer and closer to being out of a wheelchair completely. His spirit and sense of humor is still intact, but I would not wish a stroke on my worst enemy. It is an awful injury.
Sure.
And VMC does a lot there too for stroke treatment and for education on how to, stroke avoidance and how to spot a stroke. Thank you for asking. He's doing real good.
Look, I know he's still a young man, and I sense in a very short period of time he's going to be sitting here next to us doing great things. I know it. I'm not even questioning it.
Yeah.
So, well, let's kind of bounce from there to your favorite cocktail.
Favorite cocktail? Okay. Well, I went through a Tom Collins phase in my 20s. Yeah, so I have an affinity. I don't drink it too much anymore because no one else likes them. They're a little sugary. Let's be honest. They're not the best for us. Not that any cocktail is, but for old time's sake, I'm gonna say a Tom Collins.
I like that. Yeah. How about your girl dad experience?
Oh my gosh, I love being a girl dad. I have two daughters, 14 and a rising sophomore, and 10 a rising fifth grader, and they've enriched my life in ways that I can't put into words. I love them with all my heart.
They're going to locally here to one of the schools?
My oldest is going to be a sophomore at Notre Dame in downtown, and my youngest goes to the same school where my wife is a teacher. In fact, my wife was her fourth grade teacher last year, Carleton Elementary, which is in the Union School District in San Jose.
Very good, very good. Working in politics.
Yes, I think it's a good idea. I recommend it. Well, it's good to be involved in politics, and I still am. I in my own time, not as a nonprofit director. I want to be clear that the VMC Foundation cannot and does not endorse candidates. But in my own time, I believe we need to elect people that believe in healthcare access for everyone and believe in stronger, safer, healthier, more equitable communities. So I'm very engaged politically in supporting candidates I believe in, as are you. And I think we're aligned on some of these candidates.
Well, you have to, and you have to.
And we love the calls for donations. We love those calls.
Do we?
Well, I love them as a fundraising professional because I like sort of the trade craft. I like listening to the pitch because some are good at it and some are just terrible. And I'm like, you need to get better at asking for money. The first thing is not to feel bad about it because the worst thing that's going to happen is someone says no. And guess what? You don't die from a no. So you just gotta say it like you believe in it.
I think I'm going to have you ask people for money.
Well, I'm not as good looking as you are, Michael. So I won't get the yeses. But yes, let's do it together.
Thank you. All right. Well, maybe last but not least, to end on a summer note, your favorite vacation spot.
Wow. Okay. Well, there's places I go because there's family that are there that I love. But in my life, I used to spend a lot of time on Cape Cod. My father had a house there, and the Cape is like a special place to me. 3 years ago, right before the pandemic, so grateful, my wife and I and the kids went to France for the Women's World Cup in Lyon, the final. And that was, let me tell you, I hadn't been to France before. And I was as someone that, has been to Italy and Spain and sort of relates to those countries, I had a little sort of anti-French bias a little bit. Like, I've heard the people aren't friendly. And if you don't speak French, oh my God, we should all go to France. France is like, it's amazing. So France and Cape Cod are my sort of historic favorite. But I spent a lot of time in Colorado because we have family there and a lot of time in Santa Cruz because that's where my folks are.
Amen, brother. Amen. The beach is just 20 minutes away.
Yeah. And the mountains. I mean, that's the amazing part about Santa Cruz. Beach mountains in 15 minutes. And
all there. You can visit Chris on the way over. Yeah. Well, listen, Michael, thank you very much for being my fourth guest.
I'm honored. This has been great. Thank you.
Yeah, we're really privileged to have you. And we look forward to the year ahead. And we got 6 months left in this year. Let's make them great. I know you will. So to my listeners, again, this is VanPod number 4. Again, you can find this on Google, YouTube, Anchor, or whatever your favorite podcast site. Michael Van Avery, out.